What is a bridge? Obviously, it is a structure that connects two points, but it can also be a metaphorical link. Different cultures and languages come into contact every day, and the need for a bridge between them is crucial. In this case, the linguistic mediator and the translator are professionals acting as the bridge between different languages and cultures. On the one hand, there is a tourist, an immigrant, or any other individual who does not speak the language of the host country. On the other hand, there is an institutional representative, a judge, or a doctor. However, the study of this thesis goes deeper. The context changes. We are in a hospital. The medical interpreter and the medical translator will be the metaphorical bridge between two people and their cultures. According to Baraldi, the linguistic mediator, who is not to be confused with the conference interpreter, is a third party in the interaction between other participants of different language and culture, taking into account the roles and ethics of the linguistic mediator in healthcare facilities. There are conflicting opinions in the international community. The interpreter should be completely neutral and be a simple conduit, but this view is far from reality. As showed by CA, on specific occasions, the community interpreter in healthcare settings plays specific roles that should only be played by the doctor. Consequently, neutrality, which is taken for granted in the legal field, for instance, is hardly achieved in healthcare settings. The doctor-patient interaction is at the basis of routine healthcare. The physician, thanks to his or her knowledge, has total authority. The patient cannot do anything but listen to the practitioner's instructions, which are not always completely understandable due to the use of medical language, for example. This asymmetrical view changes completely when moving from a dual to a triadic interaction, that is to say, between doctor, interpreter, and patient. In such an interaction, the interpreter translates the utterances of the primary speakers. Through the skillful use of the building blocks of spontaneous conversation, such as turn alternation and repair, the interpreter's utterances can have two functions, depending on whether the interpreter merely aims at translating the utterances or only at coordinating the conversational flow. In the first case, the interpreter may decide not to translate an utterance, perhaps adding or subtracting parts of it, whereas in the second case, the coordinating aspect of interpreting may take place, either implicitly or explicitly. If the community interpreter deals with face-to-face interactions, the medical translator deals with medical texts, such as clinical cases or SOPs, as well as medical records and prescriptions. The medical translator is the expert that makes possible the understanding of texts that otherwise could not be read by patients who do not speak the local language. In addition, a good medical translator masters medical language. This language plunges its roots in the Greek and Latin culture and has evolved over time through different ways, enabling the expression of the smallest nuances of meaning. Later on, the propensity in hospitals to use the patient's relatives or friends or even nurses as interpreters or translators is very high. These ad hoc interpreters and translators do not have the appropriate training to perform this task and can therefore badly compromise the patient's health. However, even community interpreters and medical translators are human beings and are subject to mistakes, but only professionals with the right qualities such as intuition, memory, bearing, and many others, and proper education will increase the chances of successful patient care. In conclusion, in the 21st century, in several countries, including Italy, from a professional point of view, the community interpreter in healthcare facilities is little considered compared to translators, for instance. However, the situation is slowly changing. Whether people travel for business or personal purposes or because they are forced due to a problematic situation in their own country, and if they need medical care in a country with a different language, community interpreter and medical translator will be that metaphorical bridge that can lead to successful patient care.